Hey, it's Adam Sewell, MD, and welcome to Section 4.4 of the Microplastics Toxicity Training certified by the Microplastics Health Alliance. In this segment, we're going to look at something critically important for the future of clinical diagnostics: imaging and biophysical tools that may soon allow us to directly visualize or detect microplastic particles in human tissues. While laboratory testing gives us biochemical markers of exposure and toxicity, it doesn't yet give us a way to see the particles themselves, but that's changing. Emerging technologies in spectroscopy and microscopy are now being adapted for clinical research, and in the future, they may play a role in standard diagnostics for environmental medicine. Part 1. The challenge of detecting microplastics in vivo. The first thing to understand is that microplastics, especially nanoplastics, are incredibly difficult to detect once inside the human body. They are non-metallic, non-radioactive, and chemically diverse, and they range in size from a few micrometers to as small as 20 nanometers. Conventional imaging like MRI, CT, or ultrasound cannot detect them. To overcome this, researchers have turned to advanced spectroscopy and microscopy techniques, originally used in environmental and materials science, to identify microplastics in human tissue samples, surgical specimens, and biopsies. Part 2. FTIR Spectroscopy, Fourier Transform Infrared Spectroscopy. Let's start with FTIR, Fourier Transform Infrared Spectroscopy. This technique analyzes the way infrared light is absorbed and scattered by materials. Each type of polymer, whether it's polyethylene, polystyrene, or PET, has a unique spectral fingerprint. Clinical application, FTIR, has been successfully used to identify microplastics in human stool samples, Schwabel et al. 2019, placental tissue, Ragusa et al. 2021, and even lung biopsies, Ibrahim et al. 2024. In tissue samples, particles are first isolated through filtration or density separation, then placed on specialized slides and scanned under infrared light. Spectral data is compared against known polymer libraries to confirm the identity of each plastic particle. Limitations, currently ex vivo only, requires biopsy, resection, or autopsy specimens. Detection limit is around 10 microns, does not resolve most nanoplastics. Equipment is costly and operator dependent. Part 3, Raman Spectroscopy, a breakthrough in sensitivity. Raman spectroscopy is a complementary technique that uses laser light to measure vibrational energy shifts in molecular bonds. This method provides higher spatial resolution than FTIR and can detect particles down to approximately 1 micron or even smaller with surface-enhanced variants SERS, surface-enhanced Raman spectroscopy. Clinical relevance. A 2022 study by Leslie et al. Used Raman spectroscopy to confirm the presence of polyethylene and polystyrene particles in human blood for the first time. Raman has also been used to detect microplastics in lung tissue, colonic mucosa, and even breast milk samples in recent pilot trials. Raman mapping can theoretically be applied to paraffin-embedded histological sections. Future potential: development is underway for endoscopic Raman probes, which may allow for real-time detection in the GI tract during routine colonoscopy or upper endoscopy. There is early animal research exploring Raman detection of particles embedded in the blood-brain barrier, which may become clinically applicable in neurodegenerative diagnostics. Limitations: still limited to research settings. Signal interference from biological matrices can occur, requires particle isolation or signal enhancement for complex tissues. Part 4. Autofluorescence and microscopy advances. Certain plastics exhibit intrinsic fluorescence under UV or blue light excitation. These properties can be used to identify microplastics in tissue via confocal or epifluorescence microscopy. Use cases. Researchers have used this method to locate microplastics in zebrafish brains, rodent intestines, and surgical tissues from human GI resections. When combined with DAPI nuclear staining and immunohistochemistry, it allows co-localization of particles with immune cell activation markers like ionized calcium-binding adapter molecule 1, CD68, and glial fibrillary acidic protein. Caveat: not all plastics fluoresce. Autofluorescence may degrade over time. Tissue preparation must be optimized to avoid signal loss. Part 5, Future Technologies, the road ahead. Let's take a moment to look ahead. The next frontier of microplastic detection is non-invasive in vivo imaging. Several technologies are currently in preclinical development: photoacoustic imaging, Uses pulsed laser light to generate ultrasonic signals from polymer-bound nanoparticles. Early trials suggest it could differentiate plastic-loaded tissues from clean tissue based on acoustic signature. Molecular probes with targeted binding. Engineered antibodies or aptamers that bind common polymers may allow for PET or MRI detection in the future. This is especially exciting for detecting particles in the brain, lymph nodes, and reproductive organs, wearable biophysical sensors, sweat-based or transdermal patch sensors that detect excreted microplastic residues or associated VOCs, volatile organic compounds. The takeaway here is this: we are standing at the edge of a diagnostic revolution in environmental medicine. Just as troponin revolutionized cardiac diagnostics, these new tools will change how we detect and manage synthetic toxicities in the next decade. Part 6: Practical recommendations for today's physician. Until these technologies are ready for clinic use, here's what I recommend you do now. Be aware that biopsy tissue sent for surgical pathology is not currently analyzed for microplastics, but it can be if requested and sent to a research lab equipped with FTIR or Raman Spectroscopy. Consider collaborating with academic partners who are studying plastic burden in pathology specimens. Use indirect measures, labs, history, MHA screening, and clinical judgment to assess risk. Educate your patients on why we can't yet see these particles on a scan, but we can track their impact through other validated methods. To summarize, while traditional imaging cannot yet detect microplastics in living humans, research tools like FTIR, Raman spectroscopy, and fluorescent microscopy are rapidly advancing. These techniques are already confirming microplastic presence in human stool, placenta, lung tissue, and blood, and soon we may be able to visualize them non-invasively in the brain, gut, or circulation. As clinicians, we need to stay ahead of this curve. These tools are not science fiction, they are in pilot studies, peer-reviewed journals, and development pipelines right now. In the next section, we'll take this further and introduce practical clinical scoring tools and diagnostic algorithms, including how to integrate the Microplastics Health Alliance screening tool into your everyday practice. I'll see you in section 4.5.